Good morning and welcome to the Department of Labor's hearing on regulations proposed under Section 1 of the New York State Health and Essential Rights Act, also known as the New York State HERO Act. My name is Mike Paglialonga and I'm the Acting General Counsel to the Department of Labor. With me here today is Amy Phillips. Amy is the Director of the Division of Safety and Health here at the Department of Labor, and also Jeanette Lizelle, the Associate Commissioner for Worker Protection at the Department of Labor. Before we begin with our hearing, I just want to remind us of a few ground rules. First, today's hearing is open to the public and is being recorded. The recording will be available on the Department of Labor's website at dol.ny.gov/ny-hero-act. You can find more details about the work of the Department of Labor on the New York State HERO Act there as well. And additional information will be posted there soon as it becomes available. Before we move forward, I have some important housekeeping rules. Individuals testifying will be limited to 3 minutes each of oral testimony. We have a timer set up in front of you in order to help us adhere to this limit. When you see a yellow light, I'd ask that you wrap up your testimony. I will try to, if we can, give you an additional couple seconds to finish a thought, but we ask that you adhere to this so everyone has an opportunity. We also want to make sure that we can understand you. So unlike I'm sure I have been doing, please speak slowly and as clear as you can. I will as well try and do so now. The time for written submissions for this rule is open until Monday, November 22nd, 2021. And you can send those to the Department of Labor via email at regulations@labor.ny.gov. With that all being said, the purpose of today's hearing is to receive testimony and input on the Department of Labor's proposed HERO Act Section 1 regulation. It's also referred to as 12 NYCRR Section 840.1 and is titled Airborne Infectious Disease Exposure Prevention Standard, and was published in the August 25th edition of the New York State Register. No decision, ruling, order, or other decision will be made today at this hearing. Rather, we're here to get testimony, to receive information on this rule so we can better inform ourselves and inform the state on how to move forward here. With that, I'd like to hand it over to Tiffany to introduce our first speaker.
Our first speaker is going to be Jonathan Rosen.
Okay, perfect. Jonathan, I see you have unmuted your mic.
Yes, are you ready?
We are ready. Perfect. Begin when you are ready. Thank you, Jonathan.
Okay. My name is Jonathan Rosen. I am a certified industrial hygienist with over 30 years of experience dealing with infectious disease and protection of workers in the workplace. I spent 22 years as Director of Safety and Health for the Public Employees Federation, so I'm very familiar with the rulemaking process. My comments about this regulation are also going to touch on the enabling legislation. I think there's a need for improvements to both the regulations and the enabling legislation. Both should be based on the available evidence, the available scientific and medical evidence. I'm going to make 5 points. The first point is that there's an urgent need for effective workplace standards protecting New York State workers from exposure to SARS-CoV-2, especially as we're seeing a big increase in cases, hospitalizations, and deaths due to the Delta variant. A lot of people don't realize that we've had 35,000 deaths in the past month alone in this country. And in New York State, there was an average of 37 deaths a week in September alone. So the need is very great. Second point, there's no logical basis for having different standards for private and public sector workers. Labor law 27C, 27A, and education law 2801A established the emergency preparedness law. I believe those two should be harmonized into a strong, effective protection for both public and private sector workers. Third point, a cornerstone of an effective program is risk assessment, or sometimes the term is hazard assessment. This is the first step in any good program. If you don't assess the risks at your specific workplace, you're not going to come up with effective controls that are going to prevent your workers from getting infected and maybe hospitalized. Or well, then give me a little more time. So that is really an essential missing component in the regulations. And we need to recognize this is an airborne respiratory hazard. So part of the risk assessment is putting in control measures such as ventilation changes. There needs to be much more detail about that, filtration, applying the OSHA respirator standard where it applies. And fourth point is we need to have training required. There's a lot of peer-reviewed literature that shows evidence that training is effective in changing employer and worker behavior. So that needs to be beefed up. And the last point, effective enforcement is critical for any workplace safety and health standard. So that needs to be detailed in the regulations, but also the Department of Labor needs to be given funding for staffing so that there's a unit dedicated to this. If you think of the scope of this thing, there's no way that it can be thrown together with a small handful of people. We need a dedicated
Mr. Rosen.
unit, and I appreciate the opportunity to testify.
Thank you, Mr. Rosen. I'm sorry for trying to cut you off. I do want to make sure we have enough time. I want to remind everyone we do have the additional 5 days for written testimony. We will 1000% look at, review, and take into consideration anything submitted in writing as well. I will say as well, I look forward to receiving everything from everyone in that regard. So thank you, Mr. Rosen.
And I'd just like to say one last thing. In the past, the Department of Labor has worked
Mr. Rosen,
with stakeholders that are subject matter experts, including the unions, and I would encourage you to rekindle that type of collaboration.
Thank you, Mr. Rosen. Tiffany, who do we have next?
Next up, we have Jakestreist.
You all ready?
Yes, thank you, Jake.
Hey, so good morning. My name is Jakestreist. I'm a campaign coordinator at Align, and I'm the coordinator of the New York Essential Workers Coalition. We're a statewide group of over 75 unions, worker centers, immigrant rights groups, health and safety organizations, legal service providers, and neighborhood-based community organizations. Our coalition represents millions of essential workers across the state who have kept all of us moving throughout the pandemic. You will hear from some of these coalition members today, and you will also be receiving video testimony from many more workers who could not make it today because they're at work. These essential workers are mostly Black and brown immigrant New Yorkers whose communities were disproportionately impacted by COVID-19. We cannot talk about the racial disparities of the impact of COVID without talking about the lack of protections for mostly Black and brown essential workers. Our coalition came together in the spring of 2020 because these workers, their families, and their neighbors were dying. We were calling them heroes and applauding them, and yet they worked without any enforceable workplace standards in place to protect them. The New York HERO Act is aptly named to recognize the sacrifice of these workers and to ensure that they are protected during this pandemic and whatever comes next. We were proud to pass the New York HERO Act, and we want to thank the DOL and DOH for putting forth regulations that in many ways meet the purpose of the legislation. Unfortunately, in a few key ways, the regulations fall short. And I'll outline some of those areas quickly. The first area is face coverings. We should not have to sit here in November 2021 and argue that face coverings should be mandatory during outbreaks to prevent spread, but that's where we are. We know that distancing is not enough to prevent droplets from hanging in the air and spreading beyond 6 feet. Face coverings must be mandatory in the standard and not as an alternative to social distancing. The second is ventilation. We know that maximizing the amount of outside air is absolutely crucial. These ventilation controls can range from, simply opening windows and doors to replacing air filters. The subject of ventilation was heavily debated in the legislature, and ultimately they agreed that language on ventilation should be in the bill. It just simply does not align with the intent of the law to make ventilation controls optional. They must be mandatory. The last area I'll touch on is industry standards. We know that no workplace is the same and that workers know best what it takes to keep their workplaces safe. Coalition members have made recommendations on specific safety measures needed in their industries based on what they are hearing from members. Unfortunately, the industry plans are nearly identical to each other. This does not meet the intent of the law. We know the state is capable of more, having put out very detailed guidelines under New York Forward. We expect the same specificity for enforceable standards under New York Hero. I want to finish by acknowledging that over 500 New Yorkers have died from COVID in November alone, and we're only halfway through the month. So COVID is very much still a real threat, and workplace protections are crucial to keeping us all safe. Additionally, while we hear of massive labor shortages as the economy reopens, we must acknowledge that many workers are simply afraid to return. Strong New York Hero protections can give workers the confidence to return to work. So we urge you to ensure that New York Hero regulations meet the intent of the law so that workers are protected now and in the future, and to ensure that the devastation of the spring of 2020 never happens again. And I'll just double down that, not only do the regulations need to be strong, but we really need strong enforcement and a dedicated team to enforce these standards. Thank you.
Thank you, Jake. Tiffany, who do we have up?
Next up, we have Bruce Hoskins.
Thank you, Tiffany. Bruce? Bruce Hoskins. Okay, we will circle around back, but who do we have next after Bruce Hoskins?
Next up, we have Marianne Foster.
Okay, Marianne Foster or Marianne Foster? If you are on, please unmute your line. Otherwise, we will be moving to the next person to testify. Okay.
Next up, we have Richard Bloom.
Richard Plum. Good morning. I am staff attorney in the Employment Law Unit of the Legal Aid Society. Submitting written comments on the proposed regulations. I want to highlight 2 points. One echoes the points that Jake was making, that there are deficiencies in the regulations that make it not compliant with the statute, and also which present a serious obstacle to preventing transmission. In particular, the lack of a mandate on face coverings and the confusion by referring to 2 different standards on face coverings. We can't have this be something where people have to figure out, oh, do I have to wear a mask? Do I have to require masks? It should be clear instructions. If it's indoors, people should be wearing masks unless they are isolated in an enclosed space. Otherwise, they should absolutely be wearing masks. That is critical, and distancing is clearly not enough. Aerosols can travel significant distances. The 6 feet is arbitrary, basically, and it's not realistic to think people are going to be able to distance at the work site. Similarly, the ventilation issue is huge, and I would urge the department to consult with some of the agencies that I've referenced in my comments to get expertise on ventilation systems and what will actually work. One comment is that having partial barriers actually can be a bad idea because it can obstruct airflow and cause accumulation of aerosols. And similar to Jake, I want to comment on the lack of industry-specific standards. The way it was done by the department is not in compliance with the statute. The statute requires industry-specific standards, not model plans. Model plans tend to tell employees what to do, not employers. They have a lot of suggestions. I have no problem with best practices, but there have to be mandates that are enforceable as to certain things that are critical, like ventilation and like face coverings. And there are some individual specific suggestions in the model plans which should be adopted and are needed to protect people in various types of workplaces, like domestic work, like cab drivers, like delivery workers who don't have access to places to clean their hands, although fortunately in New York City that is changing under a city law. So these really do need to be taken up as mandates. So that's the comment on the insufficiency of the regs, but the main comment I want to make in tandem with that is that having mandates is actually good for business. It is good for attracting workers, it's good for keeping workers safe and healthy, and And it takes safety out of competition. You shouldn't have to compete with the business down the street by offering no face masks for your customers. And you shouldn't have to worry about them competing that way. You should all know that you have to do the same thing, and it shouldn't be a competitive advantage to endanger either your workers or your customers, because that's the sort of mood of the neighborhood or something like that. So it is to businesses' advantage to prevent the spread of this illness and to have it be mandated so they don't have to make individual decisions and pitch to their customers which is better and which isn't. Thank you very much.
Thank you, Richard. Tiffany, who do we have next?
Next up, we have Charlene OBrien.
Right, Charlene, do we have Charlene on?
Hi, can you hear me?
We can.
Okay, great.
Tiffany, do you mind resetting that back? Just thank you. Thank you.
Thank you. Hi, my name is Charlene OBrien, and I'm the Executive Director of NICOSH. We're a membership organization of workers, unions, community-based organizations, and health and safety professionals. And we use training, education, and advocacy to improve health and safety conditions in our workplaces and our communities. We were founded in 1979, and we train about 25,000 workers every year. And we're the only nonprofit organization solely dedicated to occupational safety and health in the downstate New York region. So, of course, we're testifying today in support of New York Hero. We understand the importance of the legislation, and we think that, if anything, the legislation needs to meet the intent of what was written, and that it needs to be strong for all workers to have the protections that they need. I'm going to echo what some of my colleagues had said around face coverings. Employees must wear masks to the greatest extent possible, especially for indoor work sites. As other folks have said, this should be obvious at this point, and we shouldn't really have to prove the point that workers need to wear masks. We know that this is effective. We know that the more workers mask indoors, the less likely the transmission of COVID will be on the job. I would also echo some of my colleagues around training. We need to create pools of funding that would ensure that workers can be trained on the standard itself. If we don't do this, workers simply will not know about the law and won't be able to urge their employers to follow them. So I do feel like this is really important. A law only exists if people know it exists. If they don't, then it's not going to be effective. Also, enforcement. We do need to make sure that there is enforcement of the law. And we would also think that some key industries should be highlighted in terms of enforcement, those where occupational fatalities and occupational illnesses due to COVID have been high. And I've submitted written testimony in that in detail. Finally, I want to talk about ventilation. So despite being required by the New York Hero Act, the ventilation measures are not mentioned in the current standard. And they should be. So the standard should make mention of the relative efficacy of different measures proposed. For example, the standard as written does not offer any direction on whether mechanical ventilation is more effective than natural ventilation. And so employers are free to choose the less costly option, which would be natural ventilation. This reminds me of when we were fighting for nail salon ventilation, some people said, oh, well, just open up the windows. However, there are multiple studies that demonstrate that mechanical ventilation is much more reliable and more effective than natural ventilation. So we think that this point should be clarified in the legislation itself. I have much longer written comments. I'm not going to take away additional time. Thank you so much for giving me the opportunity to testify. And I wish you luck as you sort through all of our comments. Thanks so much.
Thank you, Charlene. Very much appreciate it.
Next up, we have Lisa Zucker.
All right, do we have Lisa on? Lisa Zucker?
We do.
Perfect.
Here I am. Do you hear me?
Yes.
Okay. Thank you. My name is Lisa Zucker, and I'm a senior attorney for legislative affairs at the NYCLU, the state affiliate of the ACLU. Our mission is to defend and promote the principles and values embodied in the federal and state constitution, including the state's obligation to protect the health and safety of every New Yorker. In March of 2020, as New York was already caught in the grips of the current pandemic, Governor Cuomo declared a state of emergency and ordered all but essential workers to shelter in place. What became clear in the weeks and months that followed was that for the men and women risking their health and lives every day to perform the essential work, there were not sufficient protections in place. Legislation would be required. On May 5th, Governor Cuomo signed the New York HERO Act, enacting into law the first in the nation permanent airborne infectious disease exposure prevention standard. The law is straightforward. DOL and DOH would work to develop a general and industry-specific standards to prevent the exposure of airborne infectious disease. However, from the very beginning, the regulations have caused confusion because of the various formats the Department of Labor utilized to publish its standard, including boilerplate model plans, model templates, documents entitled standards. It has been unclear what constitutes a requirement versus what is suggestion or guidance, and whether the industry-specific templates are in fact standards required by the law. In addition, the regulations do fail to include standards that were specifically required by the legislation. At best, the regulations are confusing and fail to provide guidance. At worst, they undermine the purpose of the law itself. For example, other than the general provision section detailing the entities for whom the standard applies, the current regulations don't even use the term standard. Subsection B requires employees to establish these plans, and some of the things required by New York HERO are included. But then in truly circular guidance, subsection C goes back to the underlying legislation for which the regulations are intended to clarify. The current regulations also require plans consider and incorporate controls. Again, it is unclear why the term consider has been used. Standards require mandatory and enforceable provisions. I won't spend time talking, since most of my colleagues have also talked about the ventilation requirement, which is inexplicably absent from the DOL regulations. Those are in my written comments as well. In short, New York HERO presents an important opportunity for New York to take the lead in preventing exposure to airborne infectious disease, not only for COVID, but for the next airborne infectious disease that arrives in our state. The New York Civil Liberties Union strongly urges the DOL to, through these regulations, not to squander this opportunity. Thank you very much.
Thank you, Lisa. Tiffany, who?
Next up, we have Agnes Buzek.
Hi, Agnes, do we have you? No, Agnes Busek.
How about Debbie Berkowitz?
Debbie Berkowitz. Okay.
Do we have Jose Chimborazo?
Jose Chimborazo.
What about Michael DePasca?
Double check we're not here.
Michael DePasca.
Is there a Lisa Baum?
Yes. Good morning.
Good morning, Lisa.
Sorry. Hi, everyone. My name is Lisa Baum. I am a certified safety professional and the lead occupational health and safety representative for the New York State Nurses Association. I have over 20 years experience as an occupational health and safety representative. Since the fall of 2019, I've spent the majority of my time studying the SARS-CoV-2 virus, including its modes of transmission, health effects, and control measures to limit exposure and risk of infection. While no legislation ultimately is perfect, as there are many adjustments made by the time it is passed, the HERO Act has an important number of elements that can make a significant impact on the safety of workers in New York State during this horrific, long-lasting pandemic. Unfortunately, many of those items have been watered down or simply left out of the New York State Department of Labor Airborne Infectious Disease Exposure Prevention Standard and model plans. For example, The HERO Act requires that New York State create industry-specific standards for those industries that represent a significant portion of the workforce or those with unique characteristics requiring distinct standards. Instead, a small number of model plans, which are virtually identical, have been created. These plans do not address COVID-19 risk prevention specific to various industries as required by OSHA. These plans also do not provide adequate guidance on what perhaps is the most important method to control COVID transmission in the workplace: enhanced ventilation. Data on transmission of SARS-CoV-2 is clear. It is predominantly spread via air, aerosolized droplets, and smaller, lighter, airborne viral particulates. While cleaning surfaces and installing plexiglass sneeze and cough guards may make it seem like workers are protected, in fact, they offer little protection. And if they provide a false sense of security, then they are actually harmful to worker safety. The limited guidance on ventilation in the model plans is confusing. It appears to have been copied from another source and is dropped into the model plans, but is not appropriate for a biological pathogen such as SARS-CoV-2. Local exhaust ventilation suggestions, for example, are inappropriate for almost all workplaces and are ineffective in controlling a biological pathogen that emanates from the mouths and noses of infected individuals in the workplace. Areas listed for dedicated general ventilation do not match up with areas where there is an elevated risk of COVID infection. Unfortunately, useful guidance on effective controls for SARS-CoV-2 and other possible airborne infectious diseases for specific industries mandated in the HERO legislation is missing. Useful guidance on enhancing ventilation to increase the amount of airborne virus in indoor environments does exist. Numerous professional organizations have developed COVID-specific recommendations on HVAC filters, mixing fresh and recirculated air, improved air exchanges, and where this is not enough, the introduction of portable HEPA air filtration units. But the model plans provide little beneficial guidance or requirements in this area. What is needed is specific, effective guidance.
Ms. Baum,
Yes.
I'm sorry to cut you off, but I do have to allow time for others. If you could finish very quickly, I do look forward to reviewing written testimony as well.
Okay. We need specific guidance and mandates that will work to prevent healthcare, to prevent worker injuries and deaths in New York State. We have lost far too many of our workers from exposures in the workplace. Thank you.
Thank you so much.
Next up, we have Angela Castillo-Vilches.
Hello, everyone. Good morning. My name is Angela Castrillo-Vilches. I am the Health and Safety Program Assistant for the Northeast New York Coalition for Occupational Safety and Health. We are based in Albany, New York, serving the capital region, and our mission is to prevent injuries, illnesses, and fatalities in the workplace through community education, advocacy, and technical assistance. The New York Health and Essential Rights Act is crucial in stopping the spread of COVID-19 in our own communities. This legislation is a great first step in ensuring the safety of workers in our state as we continue to battle the complexities and risks of the pandemic. These are the workers who helped feed us, who nursed us back to health, who took care of our older population and children, who delivered necessary items to our doorstep. The workers who risked their lives at a time when the world could not stop and continued to give us that small semblance of normalcy. They deserve to feel safe and protected at work, that they will come home to greet their family after a long day's work and come home healthy. And that is why we must fervently advocate to support the reform and strengthening of the New York Health and Essential Rights Act as it continues to enhance workplace health and safety measures in every workplace across New York State. A one-size-fits-all approach will not cut it for our workers. Workplaces across the state are undeniably different in hazard exposure, workplace protections, and employer dedication, meaning that New York State should take these unique situations into account when forming impactful labor legislation. We need comprehensive but detailed protections for all New York State workers. Our communities need OSHA standards and workplace health and safety procedures enforced in every workplace across our state. They need employers to stick to their word when they say that they will protect and prepare workers for the risks of COVID-19, both ensuring their safety, but also ensuring the safety of their families. The Department of Labor must work harder to live up to the very basic expectation of our workers, that their concerns will be taken seriously and that there will be no tolerance for negligent employers. When we often meet with workers, they express that they feel silenced on their workplace health concerns. They're fearful of the amount of COVID-19 exposure and the lack of workplace protocol. And for many of them, this has been an eye-opening revelation that their employers don't strive to protect them from the many hazards that they face. Health and safety workplace committees are what we believe to be the most groundbreaking section of this legislation, because not only will it allow employees to organize and demand their safety to be ensured at work, but will also hold negligent employers accountable for the hazards that they allow in their business. And as we get worker committees on their feet throughout New York State, it is imperative that the Department of Labor and New York State officials oversee the safe organization of these committees, including protecting workers from retaliation. Developing stronger enforcement strategies to combat the real-life repercussions of employee advocacy. And we need to ensure that workers, we need to ensure to them that, they don't have to have fear of their workplace, and that their legislators and Department of Labor are doing everything that they can to serve and protect them. Thank you.
Thank you.
Next up, we have Francine Streich.
Good morning. Can you hear me?
Yes.
Hi. Yes, I'm Francine Streich. I'm the field director for UFCW Local 2013. I'm speaking today on behalf of the union president, Louis Mark Caratanudo, and our workers who couldn't take off to be at this hearing. We represent 13,000 hardworking men and women in various work settings. All of our members are essential workers who worked throughout the entire pandemic. They're in assisted living facilities as cooks, health aides, laundry people. They're fresh direct truck drivers and delivery people. They're restaurant depot workers, warehouse workers, and also in small manufacturing. They were deemed essential, but yet they were not treated as such by their employers. For example, when the pandemic began in March of 2020 at Quality King Distributors, an 800-person warehouse complex in Long Island, and our members began to fall ill, they were told by their boss that it was all in their heads. He didn't take it seriously until he contracted the virus. In 2 months' time, 60 workers contracted the virus and 1 died. Instead of professional sanitization, our workers were given a can of Lysol and told to clean their own workstations. In another instance, in Bronxwood Home for the Aged in Bronx, an assisted living facility, our members worked with residents with COVID-19, and they only had garbage bags and flimsy masks instead of gowns and N95 masks for protection. At least 30 nursing home residents became ill, and many of our members were sick as well or brought the virus home to their families. Sadly, a member there died along with Quality King. In total, 60 UFCW 2013 members died, and hundreds were ill or brought the virus home to their families. We fought for and applaud the passage of the HERO legislation, which mandates much needed infectious disease guidelines and calls on employers to provide proper PPE and other protections to its workers. We need to make sure that these plans are specific to each work site. I've heard other people say that as well. It's not a one size fits all approach. We need strong masking requirements and proper ventilation guidance spelled out and strong enforceable standards. Agencies need to hold employers accountable if they violate these guidelines. In short, permanent standards need to be strong and enforceable so that what we went through in 2020 doesn't happen again. We have workers who are still fearful. Fresh direct delivery people right now are delivering groceries to customers who do not wear masks. Workers are waiting on customers who are unmasked. And our home health aides who have to be vaccinated and masked work in homes where the patients and their families are not. We need stronger protections. The safety committees are an essential requirement of the HERO Act and will ensure that those on the front lines, the workers without representation like ours, can raise their voices and raise safety issues without fear of retaliation. I have one more sentence. It will ensure that workers receive the proper training on safety issues. We urge DOL to put out something regarding this mandate to all employers to ease the way for workers to set up their committees and to receive the training. Thank you.
Thank you, Francine.
Next up, we have Elizabeth Gonzalez.
Do we have Elizabeth Gonzalez?
What about Michael Braband?
Michael Braband. Braband.
Do we have a Mahoma Lopez?
Hello, everybody. Good morning.
Good morning.
I'm going to read the testimony of Elizabeth Gonzalez. She's one of the members. My name is Mahoma Lopez. We represent more than 2,000 members here in New York City. And yes, let me share what Elizabeth write for this testimony. My name is Elizabeth Gonzalez. I was working in different industries as a laundromat worker and also a restaurant worker in the New York City. During the pandemic, I suffered a lot of stress and I feel unsafe. I lost my job caused to the pandemic, and I still is the day I don't find any job. The majority of my concerns, that's the contact with the people or get contagious by the COVID because the lack of protection in my workplace. When the pandemic began, is no regulations at all. And as essential workers, all the female workers in the laundromats, we are informed doing an essential job, but the worst thing is the employers were very neglect. The employer never provide masks, hand sanitizer, or other protections in order to keep us safe. Unfortunately, during this pandemic, I lost my families. I lost family members and my friends. And the most sad and I feel with a lot of indignation is because when the workers, we try to organize or we try to push the employer to take actions to protect us, just basically the employer retaliate us. I was fighting because that reason, because I asked for protection. And it's a lot of workers in the laundromat industry who I know, they asked for better protection and they was fired. Unfortunately, is no enforcement, is no protocols to the employer follow these regulations to protect the workers. That's why we are here asking training and protocols and enforcement for all the unscrupulous employers. Nobody deserves to die just because we are essential. And all these things, all those things are happening has to be as an experience to create a consciousness. We cannot permit and we don't have to tolerate these bad situations against. That's why it's essential. That's why the enforcement is essential at the HERO laws. Thank you.
Thank you very much.
Next up, we have Joseph Hogan.
Good morning. Thank you for the opportunity to present testimony. I'm Joe Hogan with the Associated General Contractors of New York State. We're an association that represents 600 members throughout the state of New York, primarily general contractors and construction managers. One of the things that's important to understand is that construction in virtually all cases is a multi-employer job site situation. And so the question and concerns for part one, and it really carries on to section 2 as well, is the amount of control and what does controlling, the ability to control or exercise control really mean, and what are the obligations, what are the liabilities. We have situations where you've got a GC and CM and several subcontractors. And what is the liability, what is the responsibility? Similar perhaps along the lines of the OSHA controlling contractor standard that comes into play. By the same token, what are the abilities of the subcontractors to press for better standards on those projects as well? What is the responsibility relative to multiple prime contractors? In New York State, On building work, we have the Wicks law on public work. And so you've got at minimum 4 separate prime contractors. You've got an owner, you've got an architect, engineer. Who is the controlling contractor? And who has the ability and the right and responsibility to exercise such control? Along those lines, what is the responsibility of an owner? What is the responsibility of a designer or other third parties? Again, that are outside the contractual chain of command of a construction contract. What about those sites, those projects where the owner has not relinquished control of the site? If you're going into a building to do work, to do maintenance work, and you're sending workers in there, and the owner has not controlled that site and exercised control in that regard, and there's not a lot that a contractor can do relative to ventilation or other measures. Will each work site require a separate plan? And I think one of the big issues is the idea of indoor work site versus outdoor work site. Now, I heard a lot about ventilation and those issues. Certainly, an outdoor situation, you've got a good deal of natural ventilation. But what defines an outdoor setting? Is it outdoors if you don't have the windows installed? What are those measures that can be done in those situations? Again, where you don't have, you may be somewhat indoors, but you don't have the ability to have all the other controls for ventilation in place at that time. And with that, thank you very much for the opportunity to provide testimony.
Thank you, Joe.
Next up, we have Greg Barala.
Hello, thank you. Can you hear me?
We can hear you loud and clear, Greg.
Thank you so much for the opportunity today. I'm Greg Barala, New York State Senior Director with the National Federation of Independent Business, or NFIB, speaking on behalf of nearly 11,000 small independent businesses across every community and neighborhood in New York State. The average size of an NFIB member is 10 employees with an annual revenue of $500,000. These are true small businesses represented by our organization and who I'm speaking on behalf of today. Hundreds of thousands of small businesses in New York State were forced to shut their doors by New York State. They were deemed non-essential by state officials, designations that were completely arbitrary and undeniably preferential to large corporate employers and discriminatory to small, local, New York State-run businesses. Without rehashing the state's entire economic response to the pandemic, I will remind you that poorly communicated shutdowns, capacity restrictions, business model transformations, curbside delivery, parking lot services, creating digital presences out of thin air. These are the burdens and trials that small businesses had to navigate and develop for months. Small businesses continue to suffer enormous damage as a result of the COVID-19 pandemic. Thousands of small businesses closed their doors permanently due to COVID-19 related restrictions, which resulted and continue to result in suppressed consumer demand, decreased cash flow, and great uncertainty in the state and local economies. According to a survey by NFIB in October, 73% of small businesses have not seen their sales return to pre-COVID-19 levels. 59% anticipate that their local community will not return to pre-crisis levels of economic activity until sometime in the second half of 2022 or later. Additionally, the New York State Comptroller released a report with similar findings, including that 4 out of 5 small businesses continue to suffer from negative overall impact from COVID-19. These are sobering numbers for the state's economy, local communities, and our main streets, which bring life and vibrancy to our neighborhoods. As more and more Americans are vaccinated in New York State and the nation look to recovery, we do not have a full understanding of the economic impact of COVID-19 and related economic shutdowns. What is clear is that the pandemic devastated Main Street, not Wall Street. Business restrictions and regulations directly impacting small businesses' abilities to successfully operate are the most detrimental. Further, we find this legislation is flawed, like others, and its term of art in particular used to trigger application. Quote, highly contagious communicable disease that presents serious risk of harm to the public's health. It's vague and has no clear definition as a formally declared state of emergency would. NFIB and small business owners understand and support safe workplaces, but there needs to be flexibility rather than expansive one-size-fits-all requirements that have an outsized detrimental impact on small employers. The modeled standard should avoid severe business restrictions or limitations to the greatest extent possible. Fair expectations related to cleaning and disinfecting and having sanitizer or disposable mask on hand and hand washing stations are manageable. However, requirements to limit capacity, require distancing, deliver services remotely or through curbside pickup, and flexible work hours or work sites threaten small businesses' ability to stay financially viable and competitive. Lastly, any requirements to upgrade or retrofit HVAC equipment, install space dividers, or any other physical workspace alterations would simply be cost prohibitive and impossible for many small businesses to do. Thank you for the time and thank you for the effort.
Thank you very much.
Next up, we have Josh Kellerman.
Hello, can you hear me?
We can, Josh.
Great, thank you. Hi, my name is Josh Kellerman. I'm the Director of Public Policy at the Retail, Wholesale, and Department Store Union, RWDSU. We represent approximately 40,000 workers in New York State. Our members work in retail and grocery stores, pharmacies, food service, food processing, distribution, car washes, nursing homes, nonprofit social service organizations, and more. I first want to provide some context to my comments on New York Hero. I cannot overstate the impact of COVID-19 on the members of RWDSU. It has been deadly. Dozens of RWDSU members have lost their lives to COVID. It has resulted in workers in grocery stores and distribution centers, many of whom earn the minimum wage, fearing for their lives every day they show up to this essential job. It has caused untold misery for the poultry and meatpacking industries and workers, and has put enormous strain on our healthcare members. Amid this tragedy, I want to take a moment to commend the DOL for helping save workers' lives. The work that the civil servants of the DOL do day and night to protect workers is commendable. Thank you. I also want to ask the DOL to do more. We now have the nation's only permanent workplace airborne infectious disease standard, and it is incumbent on us to show the nation that such a policy not only makes sense for workers and businesses, but also holds employers accountable and saves workers' lives. To do this, we need stronger enforcement. Without enforcement, New York Hero will not protect workers. The DOL receives hundreds of COVID-related complaints each week and needs significant new resources to hire enough investigators to clear these complaints. We implore Governor Hochul and the state legislators to find the money to adequately resource the DOL to enforce New York Hero. We also need industry-specific guidance. The DOL has published model industry plans that are almost identical to each other and to the general model plan. For example, retail workers must engage indoors with the public on a regular basis. The risk level to these workers is sky high, yet the standard for the industry doesn't speak to what the employer should require of the public to keep workers safe. Instead, it focuses on what workers must do. The DOL should abide by the keep it simple principle. During a pandemic outbreak, which we are currently in, all people entering a retail building should be required to wear a mask, period, and regardless of physical distancing. It should not be up to each employer whether a worker is unnecessarily exposed to a deadly disease. Now more than ever, we need bold ideas to protect workers and build back better, and we look forward to working with you on these issues. Thank you for your time and consideration.
Thank you, Josh.
Next, we have Flandrecia Jones.
Hi, good morning.
Good morning.
My name is Flandrecia Jones. I'm a nurse at Bronx Care Hospital. I'm also a proud union member and serve on the board of the largest nurses union in New York State, the New York State Nurses Association. Since the pandemic began, over 56,000 New Yorkers have lost their lives to COVID-19, and countless others have been left wounded physically and mentally. Too many died just because they were deemed essential and had no choice but to go to work. They were left unprotected and ended up paying the highest price as they sacrificed their lives, working to keep our city and state running for all of us. Every step of the way, the New York State Nurses Association has fought alongside our brothers and sisters in the Essential Workers Coalition to pass New York Heroes Act. We were successful in doing that when the bill passed this May. Despite passing the bill, it has been quite challenging to implement. We have had to overcome some unnecessary hurdles, and they are still coming our way. We are tired of having to continue to fight for this law to be truly implemented. The horror that essential workers had to face in the spring of 2020 never has to be repeated. As long as we follow the science and learn from our past mistakes, we can be prepared moving forward. The best way to ensure that this is through strong enforceable health and safety protocols that are laid out in the New York HERO Act. This includes strong masking, ventilation, and reporting requirements to make sure the air we breathe is safe. We must continue to do all we can to protect the most vulnerable among us. The New York State HEROES Act protects not only workers, but our families and communities. In particular, it protects low-income, Black and brown and undocumented New Yorkers who continue to face the brunt of the pandemic while working on the front line. It is critical that our non-union brothers and sisters, many who are breaking their backs for low wages, are well supported and encouraged to have a voice on the job through worker communities. Workers on the job are best united to bring to light unsafe working conditions. They are also an important piece of educating their co-workers on safety measures in place. Finally, we must move forward with this law by understanding that we need industry-specific standards. A one-size-fits-all approach will not protect workers. Different types of work sites have unique risks that are associated with them. We know this will require more attention from the Department of Labor, but we would not be here today advocating for those measures if we did not think they were necessary. At the end of the day, this law seeks to save lives and protect all of us, and we want to ensure it accomplishes what it was set to do. We appreciate your time today, and we look forward to working further with you to ensure that the New York HEROES Act is everything it can be. Thank you for your time.
NYS Department of Labor, please unmute.
Next up, we have Edward Wang.
And thank you for the reminder for the mute. I need it.
Okay, can we have Mahoma Lopez?
Mr. Lopez, did you have testimony from another worker that you were seeking to read, or we weren't sure with your registration, so we wanted to ask you again?
No, I don't have another testimony, but just basically as a co-director of Laundry Worker Center, like I mentioned before, we represent 2,000 workers, more than 2,000 workers in the New York City. So it's super important to bring protection. That's why New York HERO law is essential to continue protecting the workers. We cannot tolerate more deaths or lost members in our community just because the employer don't want to expend money or they don't want to provide the right protection. Thank you.
Thank you.
Thank you. Next up, we have Carlos Encarnacion.
Hello. Hi, my name is Carlos Encarnacion. I'm a labor and community organizer from New York Communities for Change, which represent 20,000 members of Black and brown communities, low and moderate income people. I have been a labor and community organizer over a decade. And initially, I hold a DOL and DEP license for hazardous materials handle, asbestos. these standards, right? I'm talking on behalf of the New York Heroes Act. I think that they need to be permanent. So when the next pandemic reach our region, we don't get, the greater New York State don't get caught off guard and happen what happens, in 2020. So this is why this standard need to be permanent first. Second, this standard need to be stronger. That means they need to be mandatory masking, mandatory social distance and ventilation indoors. And third, this in New York Heroes Act need to be enforceable. A strong enforcement means that this will actually achieve the purpose that is designed for, that is protecting health and safety of workers. And I just want to make a little comparison. We have a strong asbestos standard, and DOL regulate that. But we have one difference. People that get asbestosis don't transmit asbestosis to other people. So, and we have strong standard for that. So we need strong standard for outbreak, airborne diseases, because that it's a potential. Every person could become a potential vector for the disease. So, and lastly, I wanted, kudos to the table, because everyone there is using the mask and keeping a fairly acceptable distance. Thank you.
Thank you.
Next, we have Jacqueline Lacey.
Good morning. I just want to say I concur with a lot of my colleagues who've spoken this morning, particularly around the concerns about ventilation. I'm here as a medical anthropologist researching the social and cultural context of emerging viral diseases for more than a decade, and as associate editor at American Anthropologist, the flagship journal of the largest professional association of anthropologists in the world. I'm here to share my experiences and concerns about how the New York HERO Act has been more importantly, not enforced in my workplace of more than 11 years, the American Museum of Natural History, where I'm Senior Museum Specialist of African and Pacific Ethnology. We are perceived as a trusted site of scientific communication and education. Our workplace practices, however, I believe are betraying that public trust and increasingly frightening our employees. And finally, I'm here as a proud member of DC 37 and delegate of Local 1559, and as an employee who has been struggling for more than 2 years to get my employer to communicate more transparently about the deep impact the pandemic is having on our specific worksite as a beloved city cultural institution with an enormous confluence of employees and visitors. Because of the complexity of regulatory standards around an institution like mine, that is a nonprofit, a university, and a private building on public land, my colleagues and I have been struggling and facing challenges in filing health and safety complaints due to COVID-19, as we've alternatingly been told and subsequently filed complaints with PESH, the DOL, the DOH more broadly, the city COVID-19 complaint line, and OSHA. I'd like to share my experience with you and how I have seen the New York HERO Act addressed in my workplace thus far, and in the hopes that it helps shed light on important gaps between policy and practices in workplaces across the state. Our Director of Health and Safety, Zach King, communicated to museum staff on September 3rd about the imminent passage of the New York Health and Essential Rights Act, the New York State HERO Act, and elaborated that a health and safety plan was constructed for future airborne outbreaks and future airborne outbreaks only. The emphasis on distant future potential pandemics was clear throughout the communication. In fact, the only bolded line in the email was, "It is important to clarify that the Commissioner has not called for the activation of such a safety plan at this time." However, it is my colleagues and I understanding that the museum officials met with city officials in advance of the September 7th reactivation and were briefed that the activation of the emergency plan was imminent and to plan accordingly. The museum administration never informed the staff of the full provisions of the act, and they still have never informed us that the full provisions of the act were indeed activated. My workplace never followed up and communicated that the activation of a safety plan was indeed activated. And then when I, as a woman with multiply high risks from serious COVID disease, felt terrified and unsafe to step foot on my workplace from the hazards I documented when I was last on site in July, and asserted my rights under the New York HERO Act. My employer treated both my expertise and my high-risk statuses as liabilities, while they enacted increasingly questionable and irresponsible policies. My employer ongoingly refuses to acknowledge that the HERO Act is fully activated and that our employees are guaranteed legal protections under the Act. I've been humiliated, I've been chastised, I've been threatened with discipline, and the museum has ongoingly refused to accept or even process my formal health and safety complaints, refused to process the complaints that are covered by OSHA, so I've had to go to OSHA federal directly, refused to even simply acknowledge that the HERO Act emergency provisions were ever in fact declared at all. From their perspective, the HERO Act is still only applying to a future tense with respect to airborne pandemics, and they're refusing to acknowledge and plan for the fact that we are facing an airborne pandemic now and a worsening winter to come. Thank you very much, and I look forward to submitting my written testimony in full.
Thank you, Jacqueline. I very much look forward to receiving as well.
Next up, we have Lupita Montoya.
She is coming. Hold on just 10 seconds.
Yes, I am here. I just need to unmute myself. Thank you. Can you hear me?
We can. Thank you.
Thank you. Yes, my name is, hello. My name is Dr. Lupita Montoya, and I am a former resident of New York State, where I started my professional career. I am a trained mechanical and environmental engineer and an expert in aerosols and indoor air quality, where I have spent my last 30 years. I am also an advisor to Last Mile, a network of scientists working with labor unions and other essential worker organizations to fight against that spread of COVID-19. COVID Straight Talk Lab celebrates the historic passage of the New York HERO Act as the first and only permanent airborne infectious disease standards in the country. I'm very proud of New York State. I speak today in solidarity with essential workers and to urge the Department of Labor to strengthen the standards that will ensure workers who keep our society functioning do not get sick or die because they are doing or they're going to unsafe workplaces. In both the model standard and the industry plans, the DOL needs to include more specific standards tailored to different types of workplaces for employers to follow that will improve air ventilation and filtration. The DOL's regulations should explicitly state the importance of increasing the number of air exchanges per hour and utilizing filters capable of removing viral particles from the air. Those are the aerosols we speak about. The DOL should notify employers of the following best practices that ensure that employers are doing the most they can to meet these standards. 1, mechanical ventilation systems should utilize MERV 13 filters or better to ensure the viral particles are filtered from the air. 2, that the refresh rate should be set high enough for the HVAC systems to provide 6 air changes per hour. That the HVAC systems must be kept running 1 to 2 hours before anyone enters the building and 2 to 3 hours after anyone leaves. I know that has not followed in some places, endangering the lives of people. Where HVAC systems cannot accomplish the adequate filtration and ventilation needs, or buildings have workspaces where air exchanges is difficult to achieve, that's because of the configuration of the buildings, portable HEPA filters should be used, and there should be also sufficient capacity for those spaces. Because of poor workplace standards, many of the 750,000 people who have died from COVID-19 have been workers in meatpacking, agriculture, retail, home care, among other essential industries. Many of these workers were or are low-income people of color, and the communities have been disproportionately impacted by this pandemic. These are the people that I have spent 30 years studying. Addressing COVID safety in the workplace is an equity issue, and we have a moral obligation to listen to the science and ensure people are not working in dangerous, life-threatening conditions. Thank you.
Thank you, Dr. Montoya. So at this point in our proceeding, in our hearing today, we believe that we have heard from everyone who has pre-registered to speak. If anyone pre-registered to speak that did not get called on, or perhaps wasn't on when we called you, could you please unmute your line and let us know now?
Yes, hi, I believe I registered, but was not called on.
Okay. And I hope it's okay. Ashley Johnson.
Yes, hi, good morning, and thank you for this opportunity to provide feedback on the New York HERO Act. I'm Ashley Johnson, and I work at the ACLU Women's Rights Project. We work with domestic and direct care workers who have been on the front lines of this pandemic, providing necessary care to the elderly and individuals with disabilities with few protections in place for themselves. These workers often work in isolation with no control over their workplace environment. Many of the tasks that direct care workers perform involve close physical contact, such as assistance with activities of daily living like bathing, which means these workers cannot observe social distancing practices. These workers are consistently undervalued, undercompensated, and unsupported by employers, leading to a lack of compliance with new protections, an information gap about those protections, and fear of retaliation for speaking out about potential violations. Because the home care industry is more scattered and less regulated than the residential care setting, it is more challenging to enforce workforce policies and protections. COVID-19 has upended the long-term care system as many workers have left this workforce, further exacerbating the shortage of direct care workers and straining a system that was already underfunded and under-resourced. The HERO Act is a good first step towards protecting New York's workers, but we need stronger standards and robust enforcement of the law. The industry-specific plans are in fact not industry-specific at all, but rather a one-size-fits-all approach. The industry-specific plan for domestic workers is not tailored to the unique aspects of working in someone else's home during a pandemic, and as a result, cannot adequately protect these workers during COVID-19 or any other future infectious disease outbreak. We urge the Department of Labor to promulgate more detailed industry-specific standards and not model plans that employers must abide by. Furthermore, we ask that New York allocate additional budgetary resources to ensure that the HERO Act is rigorously enforced. These workers have never stopped working, and we must do all we can to ensure their safety and well-being during this pandemic and beyond. Thank you.
Thank you, Ashley. I wanted to ask if there was anyone else who signed up but has not been called on to testify yet before opening to anyone who did not sign up and has not testified.
Yes, my name is Bruce Hoskins. I signed up, but I think I missed my call. I was the number 4 to testify.
Sure. All right, Bruce, take us away.
I think I'm probably in a minority. I'm a small business owner in Westchester County, New York. I own a veterinary practice where we employ about 10 or 12 people. We actually were affected by COVID in March of 2020. 4 of us became ill. We closed the practice for about a week's time and reopened with the remaining staff to see who got sick and who didn't. And ultimately, everybody got better with one person being classified as a long hauler. Anyway, the HERO Act, I think, is a good appropriate step. As a small business, I was able to use the template to make basically the same things that we had employed throughout 2020, mostly continuing in our practice. It's a small 2,000 square foot building. What I find confusing as a business owner is that when I go out into the community and move among places like Dunkin' Donuts, coffee shop, hardware store, I can clearly see that there is not a HERO Act in place in many of those businesses. There may be in a hardware store, there may be 8 people in an aisle, nobody masked, staff not masked, nobody's abiding by any stickers on the floor for social distancing. So I find it confusing to convey to my clients why we're still allowing only one person in at a time, why we have COVID clientele flow within our hospital. We still have some protective sneeze guards in place. We have altered some of the HVAC units to help with better air exchanges and turnovers. But I find that I have to repeatedly explain why we're still doing what we're doing when people are wondering why we are still doing it. I basically tout the HERO Act and say that's why it's in place and that's why we're doing what we're doing. So I don't know if I had been in and out of my own appointments this morning. I don't know if anybody else had represented small businesses. I heard a lot of the folks who were representing workers, and I have to thank you and applaud you for everything you've helped us get through as a public. We were deemed essential workers also. So we had been working right, except for the week we closed, we had been working right through the pandemic too. But that was my only issue was, I guess I'd like to have clarity as far as metrics, what would happen with community positivity numbers that would make a lifting of the HERO Act something that might be foreseeable. Right now, it just seems like it's been in place since September and we're supposed to be abiding by it. I think some people are doing better in that respect than others, but we don't have any guidance as to what the future holds. I can make my own guesses that it will be January after we see what positivity rates happen after the cold weather sets in and holiday gatherings have passed. But that's what I would be looking for, is what the metrics are that might make the Department of Labor revisit the HERO Act for everybody. Thank you.
Thank you. Do we have anyone else on the line who signed up but has not testified yet?
Hello, this is Mike Braban. Can you hear me?
Yes, Michael.
Good morning. I signed up late. I apologize, but I am currently the safety director for the Outworks Group, where we do snow removal and landscaping throughout the East Coast. We fully support the HERO Act. During the pandemic, we did put all of our policies and procedures in place, encouraged our employees to work from home, required social distancing, masking, and sanitizing stations throughout all of our work locations. To this date, we have not had any serious cases as far as I know of, but we are continuing to follow our protocol within, the guidelines of the HERO Act. Thank you.
Thank you. Is there anyone else who signed up but has not been able to testify yet before we open more generally? Okay, is there anyone who did not sign up or pre-register to testify who would like to offer their words now?
Yes.
Hi, so I have you as Theo Allen. If you could just introduce yourself and then take it away.
My name is Theo Allen, and I'm not right now in the market, but I do have insights into what you have proposed. You have proposed in your standard to include mandatory disinfection, but did not include ventilation. The unfortunate part is that we need to protect workers and we need to not impose burdens on employers, which are not actually going to help stop the virus. Cleaning surfaces is something that has been shown to be ineffective at stopping COVID-19, and that requirement should be taken out of the HEROES Act regulations. While hand sanitizers should be included, should be included for other reasons, not for COVID-19. And we need to instead focus on cleaning the air. I submitted comments to OSHA, and I also commented on physical barriers being implemented, and for healthcare workers, the needs for contact precautions, and even eye protection. Well, so that's actually not within the HEROES Act scope. You need to focus on what actually protects people. Vaccinations, masks, rapid testing, physical distancing, and better masks, which may include respirators. New York State should be mandating the vaccine for workers and students, and the Department of Labor should take the lead on making sure people are aware that they have the right to pay time off to get vaccinated, including when the doses become more broadly available from the FDA and CDC. I thank the Department of Labor for hearing these comments, unlike OSHA, who has not held the hearing that I requested on their standard illegally. And thank you.
Thank you, Theo. Do we have anyone else who would like to testify today before we conclude our hearing? Okay, so this concludes our hearing for today. I would normally say I first want to thank you, but I do want to finish by thanking everyone for everything they have offered today. It was really helpful. Telling you, I have a lot going through my mind. I can't wait to get back and talk about everything we have heard. But I hope that everyone has a safe and healthy holiday season, and look forward to hearing from you all more and to reviewing your written comments. With that, thank you so much, and thank you everyone at the Department of Labor for helping make this happen.
Sorry, one quick question. Can you just share the email address where we should submit our written testimonies?
Absolutely. The email address, let me make sure I actually read it because I will mess it up otherwise. So it's regulations@labor.ny.gov.
Oh, and should we flag that with anything in terms?
Yeah, if you send it in just with a HERO Act comment to something in the subject line to denote that we review every single thing that comes in that inbox and use it for a few different purposes, so it will very much get to us very quickly.
Okay, sorry, and I'm just gonna ask you one more time to repeat the address to make sure I got it right.
Absolutely, it's regulations, regulations at labor.ny.gov, and that's the official inbox we used and listed in the New York State Register. So it should be consistent to what everyone's seen in that publication.
And
fantastic. Thank you so much.
Yes.
Could I just ask what if you could quickly outline the next steps process that the Labor Department goes through for rulemaking and considering the comments and then republish?
Well, yeah, I will say, right now, and this is, we will have to conclude, but the simple is we are in the stage where we have, as of this coming Monday, we'll have received all of the comment periods will close, and we'll move forward with either changes, adoption, or something else. That's, really where we're in the point of assessing and taking everything in that you've all sent and you've all said today. We certainly don't want to give that short shrift, but we are very, very focused on getting this done and moving forward. So obviously a balancing act and a lot of hard work for us ahead, but I really do appreciate everyone's comments. And with that, I do want to conclude today's hearing and lastly, thank everyone one last time.